WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to You and Your Doctor, Living Longer and Healthier, sponsored by All County Healthcare, a Medicare certified agency. You can hear us every Tuesday night from 6 to 7 p.m. here on 95.3 FM and 1470 AM, or if you missed any of the broadcasts, it will air again next Tuesday at 11 a.m. and 3 p.m. on 95.3 FM and 1470 AM right here. You can also watch us live on All County Healthcare, their Facebook page. So just type it into the search bar there on Facebook. And if you have any healthcare questions, please call 954-717-7027 and ask for Maddie. She will be happy to answer all of your questions. So thanks a lot again for listening and welcome to the show. I'm really excited to have on the show a plastic surgeon from right here in Boca Raton, which is great. Dr. Scott Farber. Dr. Farber, welcome to the show. How are you doing today?
Doing great. Thank you for having me.
And thanks for joining the You and Your Doctor show. I want to get it right into it because I got a lot of questions about plastic surgery, and I know that our listeners do too. But first and foremost, you have a lot of experience in being a physician. You're a fourth-generation surgeon, is that correct?
I am a fourth-generation surgeon.
Wow.
Medicine and surgery has been around my family a long time. And it kind of was the impetus for me becoming a doctor and a surgeon, just seeing that sheer gratitude and appreciation of helping someone during a tough time.
Okay, so what kind of surgeons are in your family tree?
Yeah, so my great-grandfather was a general surgeon around the time where people were trying to decide either medicine or surgery. He would deliver babies and do general medicine, and he was really the generation that started the whole surgical movement, if you will. My grandfather was a general surgeon, my father was a vascular surgeon, and now I'm a plastic surgeon.
Oh, wow. So, yeah, that's a lot of different fields there.
Yep.
So the vascular system, general surgery, and now you're a plastic surgeon. Let me ask you, how did you get involved in plastic surgery? Why didn't you go into, say, vascular surgery or general surgery and follow in the footsteps?
You know, it's a good question, and I think that plastic surgery was always a very natural fit. It really combines the science and artistry that really interests me and makes me want to help patients.
And when we say plastic surgery, are there actual plastics used in this type of surgery?
So that's an interesting question, and when I would have medical students and residents working with me, it often was the first question I would ask them. And in fact, it's not that we use plastic. It's basically that it comes from the Greek word to mold, which is plastico. So plastic surgeons, plastico, because we mold and shape the body.
I never knew that. I'm glad I asked.
Well, there you go.
That's fascinating. So it's plastico. You said it was the Greek word?
Correct.
Wow. How long have you been a plastic surgeon?
I've been a plastic surgeon for 8 years.
8 years. And just down here in South Florida?
Yes, sir.
Okay. And you're right around the corner here in Boca Raton, correct?
I am. My office is Central Boca, Camino and Powerline.
Okay, that's 7700 West Camino Real in Suite 403.
Yes, sir.
Okay, let's get right into a little bit about plastic surgery. Now, I know with doctors, you're trained to provide care in a lot of different specialties, but there's always, it seems like, one amazing thing about doctors is always one thing that they do maybe better than anyone else in the area, or something that they study more or more focused on. What is your biggest specialty in plastic surgery?
So I am fellowship trained in cosmetic surgery. I did additional training in cosmetic surgery. One of the beautiful things about plastic surgery is that it's all encompassing. It goes from the head to the toe, which again is one of the things that really fascinates me about plastic surgery. So I do primarily cosmetic surgery of the face, breast, and body.
Okay. And what is the most common surgery that you do?
Right now, we're doing a lot of circumferential tummy tucks. I think that a lot of women are coming in for mommy makeovers, so to speak, where basically they're having children or gaining or losing weight, and they really want something that's going to treat their breast, body, and overall return their body to its original form. The circumferential tummy tuck is a technique where we're not only addressing the front of the abdomen, but we're actually doing a sense of a lower body lift, where you're getting raising or elevation or lifting of the thighs, lateral thighs, medial thighs, front of the thighs, as well as the buttock, in addition to really contouring the abdomen. Really restores the natural shape and the hourglass figure to these women and men.
Okay, I'm glad I asked that, because I was thinking the actual tummy, but this is different parts of the body as well.
Yeah, essentially it's a lower body lift, which can benefit not only women but also men as well. Not only does it tighten up the skin of the tummy, thighs, and buttock, but it also tightens up the internal musculature. So what happens is, basically, as you get older, or as you gain weight or lose weight or undergo or have pregnancies, the underlying muscle of the abdomen loosen, and you really can't regain that tone with diet, exercise. So no matter how many sit-ups, push-ups, or exercise you do, that is always going to be loose. So what we do is we tighten the abdomen internally as well as tighten the skin externally to really provide the best result.
So it gets to a point that it doesn't matter how much work you're doing in the gym, it just may not work, that exercise is going to help out.
Correct. There's a point to which diet and exercise works, and everyone should maintain good diet and exercise, because without it, they're not healthy, and the overall results won't be as good. However, there is a point, and after that point, only surgery can really take you to the next level.
And the other side of that is for someone who's working really hard in the gym and they've made those gains, maybe they develop like a little extra bit of skin or hangover kind of thing.
That's exactly right. So people who have lost a lot of weight essentially get deflated. So it's great that they lose all that weight, but then they have that loose extra skin that needs to be taken up somehow.
And another great thing that's going on is with bariatric surgery, how it's helping people with their health, but also after bariatric surgery, do you get a lot of cases where maybe they have the extra skin or?
Absolutely. So the circumferential tummy tuck that we were discussing really was initially designed for those patients that would lose a lot of weight and have that extra loose hanging skin to really improve that tone and really take up that extra skin. What I have been doing is carrying that over to people who may not have had massive weight loss, but just to people who may have had extra skin for other reasons. So it really is a procedure that can be used in a variety of different ways to achieve the same results.
Okay, and then this helps a lot with love handles as well?
100%. So not only does it stop in the front of the abdomen, but it helps with the love handles, the quote-unquote muffin top, if you will, the extra fat or skin in the back area. So it really does a nice job with the entire lower body.
Now, you mentioned men before, and I got to ask you because lately I've been seeing kind of men come around. They're getting manicures now. They're getting pedicures. Are they? You said that you see men come in for this kind of treatment or surgery. What kind of percentage are we talking about? Is it growing or?
Absolutely. I mean, men undergoing plastic surgery, both Botox, fillers, injectables, as well as surgery, is growing exponentially. They're kind of figuring out that they want to look as good as they feel. And the aging process doesn't stop just with women. It really happens in men and women. And as we men are trying to stay young and fit, may be helpful for jobs. You know, people want to, if they're looking to apply for jobs and they're hesitant because of they might be a little older than the routine pool of applicants, this is something that can help them as well.
And how does it work? Does someone interested in a circumferential tummy tuck, do they come in, they call the office, or they go on the website, make a consultation, and you kind of go through a body?
There are a variety of different ways you can contact the office, and we try and make it as easy as possible because we understand that not everyone has a lot of time to be on the phone and make appointments. So you can either go to the website, www.farberplasticsurgery.com. You can call the office, 561-503-2700, or you can go online and just it takes you and you can make an online consultation. The staff is very willing and able to make these appointments very easily for you, and then you come in and we talk. And whether or not circumferential tummy tuck is the right option for you or not, at least we can establish the dialogue and figure out what procedure is the best for you.
And that's Farber, Farber, and it's farberplasticsurgery.com. How long does the treatment take for a circumferential tummy tuck, and then how long is the recovery time? And last but not least, let me throw one more in there.
Three-parter.
Is it outpatient kind of thing?
Right. So it all really depends on a case-by-case basis. I mean, it's very difficult to determine how long the procedure is going to take. It really depends on what we need to do. So usually typically ranges in the several-hour mark. The recovery is not incredibly traumatic or painful. People are usually back to work within a week or two. And then...
Which local hospitals are you doing these surgeries at?
Yeah, so we work at Boca Regional, West Boca, and Delray Medical Center.
Okay, great. So Boca Regional right down the street here from the studio, West Boca Medical Center.
Correct.
About 10 miles west here, and then Delray Medical Center. Everyone knows them in Delray Beach. We have a couple more minutes before the break, and since we're on cosmetic, I want to get a little bit into breast surgery. Now, because you're fellowship trained, that opens up a lot more avenues of cosmetic options, correct?
Well, yeah, so it's very important to really know your surgeon's credentials. And the most important is that you find a board-certified plastic surgeon. So I am fellowship trained in both breast, body, and face. So I have a very good understanding of all of those anatomic areas. Other surgeons may be just facial plastic surgeons or ENT surgeons or dermatologists or other surgeons that may not be board-certified plastic and reconstructive surgeons.
Okay, and what are some of the, not to say the word cutting edge, but some of the more advanced treatments some of the more new treatments that are available today for breast surgery?
Breast surgery, there is a certain degree of normalcy and routineness that we do with breast surgery. However, the newest techniques involve the implants. They're very safe. They're cohesive gel implants where they cut them in half and they could be like a gummy bear. Okay? So they don't leak out. They really maintain their shape and form. The other more sophisticated techniques that we're using involves dermal matrices or mesh products that actually act as an internal bra to help support the implant so that there is a lot less stress on the skin.
Okay, and now are you also doing these type of surgeries in like breast reconstruction sense, maybe for someone who's had cancer?
They're definitely done for breast reconstruction as well. In fact, most cosmetic treatments start in the reconstructive side. So we use them for reconstructive surgery. We figure out what works and what really gives us the best results, and then we take that over to the cosmetic side.
And how does that work during a mastectomy surgery? So the surgeon comes in and does his part, and then you're brought in immediately, or is it down the road that they maybe come back to you when they've made the decision to have a reconstruction?
Yeah, it basically can be either.
Okay.
Breast reconstruction can be done on an immediate basis or a delayed approach. And it really is, again, a case-by-case basis in terms of the other aspects of the disease or what the situation is in terms of the reconstructive results.
Okay, and now I want to ask you again about recovery, because I think people think the first thing is how long is it, am I going to be out if I have a breast reconstruction or a cosmetic breast surgery? I know each case by case is different, but what's the typical time frame?
I generally tell my patients 1 to 2 weeks. So the majority of my procedures, patients are back in action in 1 to 2 weeks.
Oh, wow, that's quick. So that's something they can do, within the same month. They can be right back to work or
exactly.
or school or whatever they need to get back to. Now, where did you go to school? Where did you go to medical school? Let's start there.
So I went to medical school at George Washington University in Washington, D.C. Prior to that, I went to college at Tufts University. I did my surgical training in Michigan State, as well as my plastic surgery training at Michigan State. And then I did a cosmetic surgery fellowship at NYU.
Oh, okay. I was just listening to their radio program on the way here.
Yeah, absolutely.
At NYU Langone Center.
Exactly.
So I always listen to them a little bit on the way in to see what they're talking about. So you did your fellowship training at NYU?
Yes.
Okay. And what brought you down to South Florida and I guess right here in the Boca Raton area?
So I grew up down here in South Florida. I went to high school and all my schooling at Pinecrest.
Oh, nice.
So I really enjoyed it down here. I think the people were kind and compassionate, and I wanted to bring my family and raise my family down here.
Nice. Now, Pinecrest, is that in Fort Lauderdale?
Yes.
Okay. Yeah, that's not too far from here. And now this brought you to the Boca Raton area. You mentioned your family, immediate family right here in Boca Raton?
Mm-hmm.
Okay, nice. What do you think of the area?
I love Boca. I think that it's definitely up and coming. I think that we have a beautiful downtown area that's booming. The Boca Art Museum is wonderful. The new buildings and the restaurants and the culture. I think it's really an exciting place to be now.
And the medical community, there's a little bit of everything here from all different hospital networks.
The medical community is top-notch. It seems that all of the specialists that may have been in a big city before or to train understood that Florida and South Florida lifestyle was incomparable and decided to move down here. So yes, so even though we are maybe smaller than a metropolis such as New York or LA, it is top-notch medical training.
And let's talk a little bit about age range of patients. When you were saying about the Boca Raton area, I'm thinking baby boomers, but then, with men who are, maybe needing to get that, kind of once-in-a-lifetime job that we were talking about before and want to have that look. I mean, what age range of patients do you treat? My
patients literally span from 5 years old to 95 years old.
Oh, wow.
So really, that's another great thing about plastic surgery is that there is such a wide breadth and depth of practice that really is fascinating.
Yeah, I don't see pediatric plastic surgeons, so you actually treat from 5 years old up.
Yeah, so when I first came to town, I did something where we started a laceration service where patients can call us if they have a laceration or if their child has a laceration, and we can repair it in the office or at the time so that they don't have to go through the trauma or the length of time of an ER. And they get me, a plastic surgeon, doing the repair. So it's a lot more comfortable for the child. The results are good, and it's really very easy for the families.
Now, most lacerations that happen to pediatric patients, are they face, arms,
They really
legs?
can be anything. They really can be anything.
And this is important because at that age, obviously the parents don't want them to have a lot of scarring, because that can be something that can cause a lot of issues, with all that we've heard about, maybe like with bullying or something, or so that kind of road.
Yeah, so we're always concerned about scarring, and plastic surgeons are trained to repair lacerations in the best aesthetic way possible.
Wow. I actually, I'll tell a quick story. I had a family member who was actually attacked by his dog, and I found it fascinating that in the ER, a plastic surgeon was called in to repair all the dog bites on the arms. So that's something that...
it's a nice thing for the community.
Yeah.
I think that we all have to do our part to help the community and really make people be happy that we're here. So that's what I like to do to make people proud of where they live.
Okay. Now, let me ask you, since we didn't get to talk too much about the face.
Yeah.
What kind of what's the most common plastic surgery that you do on the face?
So again, and I'm reiterating the fact that it's very important to make sure that you see a board-certified plastic surgeon, plastic and reconstructive surgeon. Very prevalent today is Botox and fillers. So Botox is a way to get rid of a lot of the wrinkles above the forehead, above the eyebrows, between the eyebrows, and the crow's feet next to the eyes. Then as you go below the eyes, it really is about filler. It's all about volume. So as we age, we lose volume, and we have to replace that volume to really improve the overall aesthetics and rejuvenation of the face. So there's all varieties of hyaluronic acid fillers and collagen builders, etc., Voluma, Juvederm, Restylane products. The newest, latest, and greatest fillers actually are a little composed a little differently to help with movement of the face to make them look a lot more natural looking. So we do a lot of Botox and fillers, both men and women of all ages. We also do a lot of facial rejuvenation procedures, facelift, neck lift, upper eyelid surgery, lower eyelid surgery, brow lift. So, and they really go hand in hand. So you always, if you're going to undergo facelift, you're going to undergo eyelid surgery, you also want to volumize. You need to provide volume to make the overall appearance much better.
And the fillers and Botox, that's something that's done right in your office?
Yeah, so we do it right in the office. When we're addressing facial rejuvenation, it really is a multi-level approach. So you have to address the skin through skincare products. You really want good skincare that involve retinols and things that are going to help the skin regenerate faster and be healthier. Then you want to volumize, which is involving replenishing all the lost volume that may have happened. Then you want to lift. So it's a multifaceted approach to facial rejuvenation. A lot of it can be done in the office, Botox, fillers, lasers, skincare, and then the surgical procedures are obviously done in the surgery centers.
If someone is interested in having Botox, how often do they have to come to the office? Is it once every few months to have it done, or?
So Botox typically lasts about 3 to 4 months. So most patients will come in on a 3 to 4 month basis just as a routine follow-up so that they can look the way they want to look all the time. If patients get a little longer out of it, 6 months, then great. If they get a little less, then they want to always look the way they want to look, so they may come in a little more frequently.
I see. And We talked a little bit beforehand. I asked you a little bit about melanoma and what plastic surgeons can do for melanoma, because I noticed, like, this time of the year, I mean, the sun is blazing, and if you don't have tint on your windows, or even if you do, I mean, driving around South Florida, I drove today from Boca to Palm Beach Gardens and back here, and it was just, I felt like I got a sunburn on the driver's side. So
yeah, so it's very, very important to have appropriate skin protection and sun protection. If you're going to be in the sun, you must wear sunscreen. Everyone should be wearing hats and protective clothing. It's also very important to have routine dermatologic follow-up to make sure that they're checking your skin, to make sure that there are no suspicious lesions. Once or if suspicious lesions are found, then it's very important to take the next steps to diagnose and figure out exactly what those lesions are. Up until that point is usually where the dermatologists get involved. Once there is a diagnosis of some sort of skin cancer, then the plastic surgeon comes in to excise and repair and really take care of it.
okay, so do you work hand in hand with the dermatologist?
I work very closely with the dermatologist. In fact, it's a very symbiotic relationship. So if I see something that's suspicious, I may send to the dermatologist to work it up and evaluate it. Or similarly, if they see something or biopsy something that they don't like, they will send it to me to excise.
Okay. And where do you most commonly do surgeries for melanoma? Is it face, arms, or skin cancers in general, I should say?
It really can be anywhere.
Really?
It really can. We see a lot of it in the face, especially plastic surgeons see a lot of it in the face. A lot of times other specialties will take care of other parts of the body and then send the face to the plastic surgeons. But melanoma involves a little more larger excisions and in reconstruction, so we usually see those, and they can be anywhere on the body.
And then your job is to actually remove it from the body. So you said excise, so that's something so it's cut out of the body.
Correct.
But then your training allows you to maybe work on so there's not as big a scar or that kind of thing.
Well, once the excision takes place, then the plastic surgeon does the reconstruction to reconstruct that defect, to make it look as though it wasn't there.
Unbelievable. Well, we ripped through a lot of different topics. I want to give out your info again. We're here with Dr. Scott Farber, plastic surgeon, right here in Boca Raton. The website is farberplasticsurgery.com. Spells his last name Farber, so plasticsurgery.com. And the number 561-503-2700.
Yep.
Right here in Boca Raton, 7700 West Camino Real Road in Suite 403. So really just a few miles here from the studio that we're talking in. One last thing I want to tackle in terms of plastic surgery is that hear the term Mohs a lot, M-O-H-S. Is that something that you're involved with?
Yeah, so Mohs surgery is a specific dermatologic surgery that Mohs surgeons or dermatologists perform. Now, we talked a little bit about melanoma, and the reason melanoma is a significant disease is because it can metastasize. Squamous cell cancer or basal cell cancer or other forms of skin care that don't metastasize as often. Typically, Mohs surgery will be used to excise those basal cells or squamous cells in areas of cosmetically sensitive parts, such as the eyelid, the ear, the nose, the lip, anywhere on the face. So if you have a lesion that really cosmetics and is of the utmost importance, Mohs surgery is a technique that allows you to excise these lesions and looking at the specimen under a microscope, so that no additional tissue is taken, only the tissue that you want to take. Melanoma requires usually a larger margin of normal tissue, so it's not as frequent that we will do Mohs surgery with it.
And most of those types of surgeries are done in the office or the hospital setting?
They're typically done in the office.
Oh, that's great. So people can actually walk right out.
Correct.
And just again, for the listeners, the hospitals you're on staff at are Boca Raton Regional Hospital, West Boca Medical Center, and Delray Medical Center.
Correct.
Just one more quick question. I'd like to throw a curveball question at the end. Yeah. What are your hobbies and passions outside of medicine?
Well, my family is my first and foremost
Definitely.
hobby and passion. I also play golf. I play tennis, and I'm an avid foodie, if you will. So,
okay. You're in the right spot.
It's absolutely true. I like to cook, and I unfortunately also like to eat.
So. Yeah, you get out to these restaurants in Boca Raton, Delray, and Fort Lauderdale.
Absolutely.
Boy, we're in a great area for that. Golf, you have a favorite track around here that you golf, course?
I actually like Emerald Hills down in Hollywood.
Oh, wow, yeah.
That's one of my favorite golf courses. I grew up down there, so it has a special place in my heart.
And you said you native South Floridian?
I am.
Oh, awesome. I'm from Jupiter, here from Hollywood.
Oh, great. Yeah.
That's great. I knew we connected right away. Well, thanks again for coming on the program and kind of taking us through the world of plastic surgery kind of quickly. But I just want to let everyone know, if they want to find out more about you and a ton of area of interest, you have farberplasticsurgery.com. But thanks again, and hopefully we can do this again in the future.
Thank you very much for having me.
Appreciate it. We'll be right back on You and Your Doctor, Living Longer and Healthier.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Welcome to You and Your Doctor, Living Longer and Healthier, sponsored by All County Healthcare, a Medicare certified agency. You can hear us every Tuesday night right here from 6 to 7 p.m. on 95.3 FM and 1470 AM. Or if you missed any of the broadcasts, it will air again next Tuesday at 11 a.m. and 3 p.m. on 95.3 FM and 1470 AM. You can also watch us live on All County Healthcare's Facebook page. So we're on there right now. And if you have any healthcare questions, please call 954-717-7027 and ask for Maddie. She will be happy to answer all of your questions. So for the second half of the program, really excited to have on Dr. Clive Woods, a foot and ankle orthopedic surgeon. Dr. Woods, how are you doing tonight?
Doing great.
Thank you for coming on the show, You and Your Doctor, Living Longer and Healthier. Man, I'm a big fantasy football guy, and last year there were so many foot injuries.
Oh, yeah.
I have so much to ask you about because I'm trying to think of what I want to do with my teams this year.
Yeah, exactly.
Do you get a lot of those questions from patients?
Yeah, actually, I get a lot, especially like the most recent injury from last season was Derek Carr when he had that ankle fracture and syndesmotic injury. I remember even actually a couple years ago when RG3 had that dislocation, I had to go on the radio to talk about what does an ankle dislocation entail and the treatment. And big thing for him is mobility. So a lot of people are like, well, is he going to be able to be mobile? I guess we kind of know what's going on now, but
yeah. And it can affect, if you have a bad foot or ankle, it can affect maybe other parts of the leg, the knee, maybe even go up to maybe even the hip.
Oh yeah, for sure. I mean, a lot of times, and even in the office, I see this a lot where, if you have an ankle injury or even rehabbing it, one of the biggest things why I like people to get into physical therapy is when they're getting back and rehabbing, making sure they're walking correctly. Because I have people that come in and it's like, oh yeah, I'm compensating because of this leg, putting a little bit more pressure on the other side, so that's bothering them. Or sometimes the knee because they're walking different, trying to offload certain areas. So yeah, it can definitely kind of go from the foot all the way up to the knee, hip.
Well, I know you're a foot and ankle surgeon, and you tackle a lot of different treatments, but and one thing I find amazing about doctors, I was telling the doctor before, is that when you guys treat so many different guys and gals, treat so many different conditions, but then you're able to specialize and be maybe one of the few in this area to tackle a certain condition. What is your main specialty?
So my main specialty is orthopedic foot and ankle surgery, and what that kind of entails is anything from fracture care of the ankle to reconstructions of, if someone had any kind of flat foot deformity, ankle replacements. I do bunion, hammer toes. I also do neuromas. That's the reason why I kind of like foot and ankle, because it's not just, the replacements. It's not just fracture care. You can do soft tissue, Achilles tendon tears. So you kind of encompass all of orthopedics, but it's mostly focused on the foot and ankle.
Let's stay on Achilles for a second. I never knew foot and ankle surgeons actually treat Achilles tendon issues.
Yeah, for sure. We definitely do a lot of Achilles. Actually, I have one tomorrow. And the thing about Achilles is that a lot of the times back in, a couple of years ago, a lot of the Achilles surgery, we do that open. And what I mean by that is a larger incision. And the main thing with Achilles repair is wound complications. But, a lot of times when you fix this, the chance to re-rupture is less. Nowadays, now what I'm doing is minimally invasive Achilles repair. So it's done through a small incision, transverse incision, approximately 2 centimeters and 2 stab hole incisions. So wound complications are down. In addition to that, before you could not step on an Achilles repair for about 6 weeks. Nowadays, with this new technology, in 2 to 4 weeks, you're able to put some pressure down, walking in a boot with a little bit of lift to offload the Achilles. So with the technology now, people are getting back a lot faster.
Yeah, so a great case. They're back in half as much of the time as they used to be.
Yeah, for sure.
Out for the Achilles injury, I should say.
Yeah.
Now, the Achilles, does it come up from the heel and move up the back of the leg?
Yeah, so where the Achilles inserts on the heel, or what we call the calcaneus, and then it kind of blends into the calf muscle, which is the gastroc and soleus. And with the Achilles, there's so many different. It's just not ruptures, because I do a lot of Achilles things. So meaning like you can have the normal Achilles rupture from the weekend warriors. You go out on the weekend, you play some basketball, then you feel like someone either threw something in the back of your leg or kicked you, and you're looking around, and usually it's a Achilles rupture. And then I also have patients that have just wear and tear of the Achilles tendinosis. You can get Achilles tendonitis. You can even get problems where the Achilles inserts right into the heel. So I also do a lot of surgeries for that, sort of that insertional Achilles pain.
Okay, and then the Achilles now, I've heard that it can, when it ruptures, it can be a very excruciating pain. Oh, yeah. Have you heard that from your patients?
Yeah, for sure. A lot of times this is the typical story that you hear, is that when they have an Achilles rupture, they kind of, like if you're playing basketball, they always think like someone hit them in the back of the leg with the ball, or actually kicked them. The best story I ever got was a boxer that I did, professional boxer, that he actually was training, and he thought his trainer actually kicked him in the back of the leg, and he was getting ready to turn around and punch him. and he was like, no, I didn't do it. So I definitely wouldn't want to be that trainer. But it's definitely excruciating initially. And then after that, it kind of settles down.
And do you see those injuries, Achilles injuries of all ages, or?
Usually, so it depends on if you have an Achilles rupture, a lot of the times when you're going to see that is around that 30 to almost 50 range, because what ends up happening where it actually ruptures, the blood supply to that area is not good. And a lot of times you get people going out playing, basketball that weekend or softball, and next thing you know, they're running for a base, or they're jumping up and they feel that pop.
And then that's when they have to see a foot and ankle surgeon.
Yeah, exactly. Yeah.
Get on the speed dial there.
Exactly.
Now, going back, because I got to get a little insight in my fantasy football world.
Okay.
So a big thing last year was turf toe.
Yes.
What actually is turf toe?
So what turf toe is, on your actual big toe, there's a structure called a plantar plate that kind of, in a sense, holds that bone and that joint together. And so, yes, you have flexibility in your big toe, but what it allows you to do is kind of get that push-off power. The reason why they call it turf toe is because before everyone played on grass, so there was a little bit of give to the grass. Now with artificial turf, it's a little hard. So a lot of times with wide receivers, you can see they don't get that push-off power when they're trying to run, because they get excruciating pain from that.
Now, turf toe is something that can be treated with just without surgery, or is it something that they have to have surgery?
Yeah, well, it's kind of two ways. It's definitely something that can be treated without surgery, depending on the severity of it. A lot of times, just some immobilization, some rest can get that better. In addition to that, sometimes you can put what we call a carbon fiber insert, just trying to stiffen that sole of that shoe, so when they're trying to push off, they're not putting as much pressure on that toe and causing what we call dorsiflexion. So that's dorsiflexion is sort of when that toe goes up.
Okay. Now, and if surgery's not needed, are you available to do sports medicine and watch them through the process and provide
for sure? Because
treatment?
a lot of the one thing about and that's another reason why I got into foot and ankle, because a lot of sports medicine orthopedists don't do as much foot and ankle. They'll do Achilles and maybe like what we call an osteochondral lesion. But I kind of take care of all of the foot and ankle sports. So especially in my practice, we do a lot of sports. So I do all the Achilles, the what we call osteochondral lesion, turf toe, Lisfranc injury, all of those things.
And let's talk a little bit about your practice. You're with the Gelb group.
Yeah.
So the website's gelbmd.com. And that actually is right here in Polk as well, correct?
Correct, yeah.
Okay, so tell me a little bit about the practice. They had a great website. I was on it before. I got a ton of info on you. I thought it was really easy to use. So I think that's what people are looking for nowadays.
Exactly.
A lot of people are making decisions off of videos and websites, so it's important to get good information out there.
For sure. I mean, in our group, it's myself and Dr. Gelb. He does most of the sports, shoulders, elbows, knees. I do all of the foot and ankle and even the sports foot and ankle. In addition to that, we have in the office x-ray, so you don't have to worry about going to get an x-ray. In addition to that, we also have physical therapy. So we have 2 physical therapists, and we have approximately 3 to 4 physical therapy assistants. So a lot of times when we do surgery, we send you over to physical therapy, and we can keep a close eye on you to see how you're progressing.
Oh, nice. So it's like one stop for everything.
Exactly.
Physical therapy on site, x-rays on site.
Yep.
Foot, ankle, orthopedic care. That's great. Now, how long have you been with Dr. Howard Gelb?
Yes. So I've been there since 2003. So I just finished my 4th year, going on my 5th year with him.
Okay. Since 2013, last 4 years.
Yes. Yeah.
Okay. Just want to make sure. That's great. So you're right here in Boca Raton. What hospitals are you on staff at?
So I'm on staff at West Boca Medical Center. In addition to that, Northwest Medical Center. And I also operate out of a surgery center called Park Creek Surgery Center.
Oh, wow. 3 different ones.
Yes.
And then also available in the office as well for for consultations and treatment options that don't require surgery.
Correct.
Like maybe a turf toe or something like that. I want to ask you also, you talked a little bit about ankle, but we didn't really get into it, and I know that is a huge part of your practice.
Yes.
Now, starting with ankles. Now, I know the most common in my experience with ankle injuries were for the ankle to turn inward like this. Can the ankle also turn the opposite way and be a sprain or a break?
Yeah, definitely. You can definitely, what we call that motion is the typical way that someone sprains their ankle is inversion. So that's the turning in. But also you can evert it. A lot of times people have inversion injuries, which ankle sprains are one of the most common things that you'll see in the ER, and I treat a lot of ankle sprains. And the one thing I do with ankle sprains, especially being a foot and ankle surgeon, a lot of times I get people going into, let's say, the ER or something like that, and they get this ACE wrap, and then they come to me 6 weeks, 8 weeks later, and like my ankle still hurts. Usually for ankles, a lot of times I kind of mobilize them and get them in a boot for about 2 weeks to get it to calm down. Then I get them into a lace-up brace, and we also go over some physical therapy things to get them back into playing whatever they do. The other thing that, like we were talking about with the actual Achilles repair, there's also new things that is going on with a actual ankle instability. So a lot of times ankle sprains don't require surgery. However, if it does not heal back correctly, meaning a little stretched out, or if it doesn't heal and the ankle's constantly rolling, that can be a bad problem where people get arthritis. So what we actually do is reconstruct those ligaments. In addition to that, there's a technique where we use an implant called an internal brace, which nowadays what that does is it's a actual suture that's pretty strong. And before, we would have to cast you for 6 weeks so the repair doesn't stretch out. With this internal brace, once you put that in there, you get literally, if I wanted to, in 2 weeks, can get you walking in a boot. Funny thing is, I have one of my patients now that I actually play golf with, and she comes in and she's walking, and at 6 weeks I see her at the golf course, and I'm like, I don't think I cleared you, but she says she feels great and she's swinging the driver, so that's good.
Well, that's got to be great to see. Yeah. I mean, you didn't want to see her out there already, but
yeah.
But that's a testimonial to the care you provided, though, and in a way, so it's good in. Yeah, so those are some treatments for, I guess, stretch ankle ligaments that you were talking about. So that's not actual broken ligament. That's something that's stretched, in some cases broken with the internal brace.
Yeah. So what this is so what I'm talking, I also explain a lot, because a lot of times I get patients that come in and say, oh, the doctor said my ankle was sprained, but it was torn. Usually what an ankle sprain consists of is 3 grades. One is ankle sprain, grade 1, which is it's kind of stretched out. Grade 2 would be a partial tear, and grade 3 would be a complete tear. So a lot of times those complete tears, the grade 3s, or sometimes may require surgery in the future if they have chronic ankle instability where the ankle continues to roll.
Now, if that happens to one of the listeners or even myself, would the best thing to be do still obviously get to the emergency room or a foot and ankle surgeon? Yeah. But if you can't get right away, is ICE still the acronym ICE, compression, elevation? Is that something still you recommend if you can't see someone right away?
Exactly. So that if they're not able to get in to see me or get to the ER, that would be the first thing that I would tell them to do. So you want to ice, compression, elevate, and even try and do a little bit of mobilization. So it's that what we call RICE therapy.
And then now, do you also are ankle fractures common too?
Oh yeah, for sure. I do a lot of ankle fractures. And you see them a lot in the ER coming through, and I also have a lot of people that refer me ankle fractures. A lot of the times, depending on what type of fracture it is, because there's a whole classification for different type of ankle fractures. Some can be treated non-operatively, meaning just casting or replacing in a boot when they have like a simple just fibula fracture. But when they have 2 of the bones kind of broken and the joints kind of out of place, those usually require fixation.
Okay, but there are some options that non-surgical options for ankle fractures. Well, that's good to know. Mm-hmm. Definitely. We're here with Dr. Clive Woods, foot and ankle orthopedic surgeon, located right here in Boca Raton. The best way to get some more information about Dr. Woods is gelbmd.com. That's GELBMD.com. His partner is Dr. Howard Gelb, who is an orthopedic surgeon as well. And you said treats shoulder.
Yes. So what he does is he's fellowship trained in sports medicine. So he does a lot of shoulder injuries, elbow injuries, knees, hips. In addition to that, he'll hip replacements, knee replacements, so ACL injuries, so all of the sports injuries.
Nice. Wow. You have a great practice there. Now, we talked a little bit about Achilles. We talked a little bit about the ankle. Now, another part of the foot I think that's commonly, injured is maybe the top of the metatarsals. Is that a common injury? Because I know when I played basketball, I fractured the fourth metatarsal, I want to say.
So a lot of times with the metatarsals, that's the one that can be treated non-operatively if it's a single metatarsal. It really also depends on the displacement of the fracture. Other things that can kind of lead you to operative treatment is if you have multiple metatarsal fractures. One of the bigger ones that everyone talks about is what we call the fifth metatarsal. So we call it Jones fracture, and that's one that everyone just was talking about with Kevin Durant, and everyone's like, well, now it's sore. The problem with Jones fracture is the blood supply in that specific area is not good. So it takes a very long time to heal. So let's say if your fourth metatarsal fracture may have only taken 6 weeks or up to 8 weeks to heal. Well, these Jones fractures can take 12 weeks or even sometimes longer. So for a professional athlete or even our college athletes, that's a long time, 3 months out. And let's say after that, you're like, okay, well, it still hasn't healed. Now you have to do surgery. So what we actually do for that is simple incision, minimally invasive, a screw that we put across that metatarsal fracture to cause some compression and allow it to heal.
And that fifth metatarsal, that's on the outside. That would be from the pinky toe all the way into, I guess,
correct,
the leg bone there?
Yeah, so where it would actually be located is if you take your small toe and you kind of bend it up, so right where that creases in that joint, that's the head of that bone, and then you kind of follow it back for a couple, probably I would say a good inch or two, and right at that tip, you'll feel like a little prominence on the side of your foot in the midfoot portion. That'll be the tip of that fifth metatarsal. But where you actually get that fracture is what we call the Metatarsal Junction. And what that actually is if you look at the metatarsal, there's sort of this flare, meaning that the actual bone kind of funnels in, and right where it goes from funneling to straight, that junction right there is very poor blood supply.
Oh, wow. I didn't know that. That's fascinating. So we went from the heel to the ankle to the top of the foot.
Yep.
Let's go around 360. Underneath, another basketball injury is you don't hear too much about it, but I think it happens with wear and tears with the sesamoids.
Oh, yeah.
Maybe is that the ball of the toe?
What
area?
I tell people the sesamoid is, easiest way to know what a sesamoid is. So a sesamoid is a type of bone. It's a bone that floats in a tendon. The most common one that everyone will know is the kneecap. The kneecap is that's the largest sesamoid bone. Now, what you actually have sesamoid bones in your thumb and in your big toe. So I get a lot of times I'm showing an X-ray and the patient goes, "Is that a fracture right there?" I'm like, "No, that's your sesamoid bone." A lot of times where I see these sesamoid bone injuries are a lot of my ballet dancers, because they always go on end point. In addition to that, it really depends on the shape of your foot can actually cause a little bit more stress. So people with very high arches and what we call plantar flex, so that means the first ray of that big toe kind of points down a lot, so they put a lot of pressure on that bone. They can get it that way. I have nurses that actually are in the hospital that have those type of injuries just from walking all day. They get stress injuries. I actually had one girl who she went to UCF, and I guess the thing at UCF is to go to Disney World every week and ended up with a sesamoid injury. Yeah.
Oh, wow. Yeah. From walking on her toes at Disney World.
Yeah.
Do you see a lot of, you mentioned a couple different sports. Do you see a lot of injuries from cheerleading as well? Basketball, football, soccer?
Yeah. And usually, so I see all of those injuries. So cheerleading, I get a lot of ankle sprains.
I was going to say that.
Same thing with basketball. Other things that I get in basketball are Lisfranc injuries. What a Lisfranc is it's a ligament that goes from the base of the second into a bone called your medial cuneiform. One of the biggest ones that everyone knows is when Udonis Haslem had that foot injury. That's what he actually had. So that's one thing that I treat a lot too. In addition to that, football, you get all kind of fractures along with the ankle sprains. Yeah,
it happens. And Udonis just signed again, right? That's awesome.
The Mr. 305, love it.
Yeah. And you have a tie to the Miami area. Did you go to medical school or train down there?
Yeah, so I trained, did my orthopedic training at University of Miami Jackson Memorial. So I did orthopedics there for 5 years. And then after that, I did a foot and ankle fellowship with one of the well-known physicians named Roy Sanders, along with Arthur Walling, who are very well-known in the orthopedic foot and ankle community.
Wow, and did you work with the University of Miami sports programs?
Yeah, so when I was down there with Dr. Lee Kaplan, I did a lot of work with him at the football games with the University of Miami, also the basketball team. We would also help the women's soccer team, women's basketball. So we were kind of everywhere with the University of Miami and also with the Marlins at that time too.
Oh, wow. Two great programs. Are you a Hurricanes or Marlins fan, or what's your team?
So my team is, that was the weird. I am a Miami fan, but I went to Florida State, so that kind of took over. So I'm a big Florida State fan, and I love Dolphin and Heat. That's
okay. Yeah. Well, that works. Yeah. We'll allow that. Yeah, definitely. Do you get down to? Is that something that you do during the season? Get down to a few games?
Oh yeah, for sure. I'm always at the Dolphins game. I grew up right by the stadium where I can literally go and lay on my mom's truck, and now I can't see the jumbotron because they covered it. But back in the days when I was a kid, that's what I would do.
Wow, that's fantastic. I've been a Dolphins fan since day one. Did you grow up down here?
Yeah, I grew up in Miami Gardens. Went to Miami Carroll City Senior High. Okay. Big football team. They just won the state championship, so that's good.
That's awesome. Congratulations. Now, I had two doctors on tonight. Both were Florida natives. I'm a native. I'm from Jupiter. That's really neat as well. Lastly, what are your areas of interest outside of medicine? Do you play a lot of golf?
Yeah, I play a lot of golf. That's my passion there.
Perfect. Thanks again for coming on the show, Dr. Clive Woods, gelbmd.com. I'd like to interview you again in the future. Thank you.
All right. Appreciate it. Thank you. Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of